if this reversal in NI happens, you ain't going to get anything.
No, Alistair, we're kind of used to coming second in every race to seek any funding, even to get white papers. It would help us immensely, and I'm sure as we work alongside our colleagues with the NHS, that something that could is bringing us closer together so that we work as a whole, so actually the funding comes to both. But at this minute in time, the Liz Truss decision was quite a shock to us all.
Herself or Rishi Sunak, as an expert, you know, it's your field, it's where you work, you employ people within it as well, that gives you any hope, because both Henry Hill and Sean Worth in that last conversation were saying NHS and care just hasn't been on the agenda. And Henry Hill, intriguingly, said, and I can understand why, it's dynamite.
No, absolutely. It's been the same for years and years, Alistair. This is nothing new. When COVID came along, social care came more into the spotlight. We're working alongside the NHS. The NHS struggles without social care. The NHS has so many people in beds at this minute in time that are not there for medical reasons. They are there for social reasons. And that's what we're there for. And we're there to support the NHS. Now, if we don't get the funding, and therefore we cannot get the people that we want in to pay them the amounts that they should be paid, then we're going to really struggle. And at this minute in time, we are really struggling.
Yeah. You remind me of the fact that I think it was Andrew Dilnot who famously had the first go at really looking at how the sector might be reformed, because, of course, anyone listening to this conversation who is a user of the care system will know that the majority of folk, and my brother and I went through it with our dad, pay for your own resources because you're lucky enough to be in that position. The actual support that can come from the state, local authority is pretty limited. That was supposed to be a huge change in the middle of the Johnson administration. It's gone out the window.
Yeah, Boris Johnson initially stated that nobody should sell their house to pay for their own care. Unfortunately, people in social care, the people that have fought in wars, that have paid taxes all of their lives, seem to be now the forgotten about people in this country. And it's sad and it's really difficult, and we really need to put something back into social care so that people can get the treatment that they deserve at the end of their lives. It's so sad, Alistair.
But do people like you and your colleagues, because I know at the level you operate, clinical director, you talk to all sorts of people in leadership within the care sector. You know, one of those magic questions, let's assume that Liz Truss won, and she picked up the phone and said, I heard you on GBNews the other day saying, oh, it's all dreadful. What specifically do you want done immediately? What's the first call that would really help your sector, really help those men and women in care and those who are getting close to needing care? What would your key answer be?
I think the first thing, Alex, that has to be reformed. The whole of NHS and social care has to face reform. There needs to be more money given to local government so the funding can be accurate. The people that work in social care, that deliver the care, and also in the NHS, are paid for what they do. At this minute in time, you could work at Sainsbury's or Aldi or Lidl, and you could get more money than you do caring for people in social care. It's not about making people a cup of tea. It's a lot more than that. It's a lot different than that. And it's the people who do it are immense, and I am so proud of them for what we've been through. But it's becoming really difficult. We can't recruit because people don't want to come into social care because there's not enough funding to be able to pay them for the amount that they're worth.
There was a lot within that answer that was about money, whether it was pay or financial support for the costs, and I do understand that. But you said twice in that conversation something that strikes me as being a really important point, and that is the coordination between the health sector and care, because some of the problems in hospitals are, as you or others might call them, bed blockers, people who the hospital have done all they can do for. They either need to go home, if that's safe and OK, or they need to go into care. Is there an easy way that doesn't cost a lot of money, whereby the NHS and the care sector could be bolted more together?
I think without looking at it, and again, it comes down to that massive reform, looking at the whole of the NHS as a service, and also with social care and the way that that's doing. So many homes have closed, Alistair, which leads to the fact that there's not many beds left within social care, and those that provide it are struggling to do it because of the staffing and things like that. It needs to be a whole reform. We've been promised white papers, green papers. I can't remember what other colour papers have been promised. Nothing's come to fruition. It seems that it's a forgotten about industry, and the NHS is something that we should be very proud of in this country. But the NHS wouldn't be what it is without social care backing it up.